Hi friends, I am Dr. Suresh Bharadmat, Professor of Psychiatry working at NIMHANS Bangalore. This October 10th, we are celebrating World Mental Health Day. And this year theme is Mental Health for All, Greater Investment, Greater Access, Everyone for Everywhere Mental Health Care. So this theme is really wonderful. What was the need of this theme? National Mental Health Survey clearly said that 10% of our population is suffering from mental illness. This study was commissioned by Ministry of Health and Family Welfare, and the study was undertaken by NIMHANS Bangalore. The same study talked about 70 to 86% of the population are not on treatment. That is treatment gap. That means in spite of treatment is available, they are not on treatment. There are various reasons for not being on treatment. First and the foremost may be stigma and discrimination. At the same time, people believe that being on psychiatric medication is a weakness. It causes addiction, which is completely wrong. Even the educated people and the doctors say, why are you taking psychiatric medication? This kind of myth and stigma causes the hindrance or obstacles for access to care. There was another landmark study was conducted. That was magnitude of substance abuse by Ministry of Social Justice and Empowerment. This study's report was disturbing. The main reason being is the results of the study. The study reported 3 crore population is dependent on alcohol. It's not just the 3 crore population, it is 3 crore families are suffering because of alcohol. At the same time, 25 lakh people were dependent on cannabis, 28 lakh people were dependent on opioid drugs, 10 lakh people were dependent on cocaine, and 7 lakh children are dependent on solvent abuse. These drug abuse not only affects the individual but also the whole family. Not only this, National Crime Records Bureau in 2019 came up with stunning report of suicide, which said that 1,39,123 people committed suicide in 2019. For every completed suicide, there are 20 attempted suicide. That means every year 28 lakh people attempt to commit suicide. With regard to suicide, the Mental Health Care Act, Section 115 clearly talked about the decriminalization of suicide. Whoever attempts suicide shall not be charged with Section 309 IPC. Section 309 IPC clearly says that whoever attempts suicide shall be punishable with 1 year imprisonment with or without fine. So this caused hindrance for access to care, at the same time providing care. To overcome this obstacle, the Government of India decriminalized the attempted suicide by introducing Section 115 in Mental Health Care Act. With regard to government investment on mental health care, there has been paradigm shift. First and the foremost, in 2014, National Mental Health Policy was drafted and released. Immediately, the Ministry of Health and Family Welfare commissioned the study called as National Mental Health Survey, which is available on their website. And a landmark legislation was passed. That was Mental Health Care Act of 2017. In this, the government showed their commitment by passing this legislation and Section 18, which talks about access for mental health care. That is, every citizen has a right to access for mental health care. The mental health care here, the access for inpatient care, outpatient care, free medicines, basically essential medications, both allopathy, Ayurveda medicines should be made available, and also it talks about rehabilitation. By chance, if these services are not available in your district hospitals, you are entitled for compensation. That's what the commitment the government has shown. But unfortunately, the general population, educated public, they discuss that mental illness is not treatable, you have to take treatment from faith healers. That needs to be stopped. We have to invest in educating the people, making aware that mental illness is treatable, curable, and also we have treatment available. We need to make efforts in this regard to provide care for everyone. The digital technology has made a great difference in this regard. So we need to use this digital technology to reach the unreached. Although the pre-COVID talked about 10% of our population is suffering from mental illness, we do not know the post-COVID scenario. The post-COVID, the mental illness may increase. So we need to get up now. We need to invest. We need to provide access to care for everyone. So dear friends, now we have to pledge that this year theme, which talks about mental health for all, greater investment, and investment is not only in terms of money, it is in terms of education, in terms of removing stigma, discrimination. At the same time, we have to make efforts for greater access for mental health care. Please take care of yourself. Stay safe. Thank you very much for your time.